Main reason for this event today was, first of all, to provide information that the American public deserves to know, that they're not being told, but anything we could do to prevent further harm. I don't want to scare the you-know-what out of people. I don't. None of us do, okay? But they need to have that information.
V-Safe is the CDC's premier vaccine safety system for the COVID-19 vaccine. This is a dashboard that ICANN created to be able to visually represent the V-Safe data. About 800,000 people reported needing medical care in the database of 10 million. That's about a 7.7% of people in V-Safe reported needing medical care. That is 1 in 13 people. Yet the CDC did not pull the shot.
In January 2021, I came before you as a military whistleblower reporting catastrophic increases in illnesses and injuries across the DoD. The total number of reportable events went from 110,000 in 2020 to over 200,000 in 2022. The vaccine was introduced into the military in January of 2021.
We generated hundreds and hundreds of charts, looked at this every way from Sunday. The UK government, until this summer, was reporting a data series that showed the relative mortality rates for the vaccinated and unvaccinated by the number of doses of the vaccine. It simplifies down to a conclusion that says that through the last available data set, the people in the UK who took the vaccine have a 26% higher mortality rate.
This is the Society of Actuaries. In 2021, in ages 25 through 64, the employed people of our nation covered under group life, they experienced a 40% excess mortality. 1.2 million additional Americans in the employed segment of our population got disabled. That is the size of the state of Wyoming and Vermont combined that disappeared from the labor force.
As a journalist, I looked at the emergency use authorization for the vaccine. We wanted to see had they achieved the stopping transmission, which is our definition of a vaccine. But when we looked at the emergency use authorization, what was known was that the data are not there, limited to assess the effects of the vaccine against transmission of SARS-CoV-2. They had no idea. They had no idea if it would stop the infection, yet they were making those statements on the news. And now we find out from the heads of Pfizer that they were never even testing inside the trials whether or not it could stop transmission.
In January of 2020, I was working as the senior advisor to the FDA commissioner on drug safety and FDA science policy. I don't understand how in good conscience we can still be giving these vaccines at this point for the COVID-19, named after 2019, for a strain of the vaccine that no longer exists.
This spike protein, when we inject this gene into the body and start hijacking your cells to make it, these natural killer cells now look at your own cells, they poke a little hole in those cells, and then they throw a little hand grenade in and start blowing them up. It's not just that this spike protein is dangerous. The lipid nanoparticle will go anywhere into the body. It was designed to carry chemotherapeutic agents to the brain. You don't want spike protein in your brain.
We now have data from multiple sources that the spike protein, which the current mRNA vaccine products ask the body to make, are cardiotoxic and cause the heart to be inflamed. The spike protein sets in motion a cascade of events that activates platelets to form clots and inflames the blood vessels lining the heart and the heart muscle itself.
What I'm seeing clinically is now patients have taken the vaccine and they've had COVID and they've taken the vaccine and now it's all mixed. And there's multiple exposures. The more exposures there are, in my estimation, there's greater risks of myocarditis and recurrent myocarditis and blood clots and more blood clots. And the FDA and the manufacturers strictly excluded COVID-recovered patients from the clinical trials because of that fact.
I've seen 3 strokes, transient ischemic attacks, massive clot to the spleen and liver, spinal tumors, brain tumors, sarcoidosis, lupus, cognitive impairment, myocarditis, pericarditis, and I see a shocking suppression of the immune system that is pervasive.
My patients are women of reproductive age, pregnant women, and preborn babies. And what I've seen in my clinical practice has been a substantial, massive increase, unprecedented in menstrual abnormalities prior to pregnancy, a substantial increase in infertility, a substantial increase in miscarriage, fetal death, and fetal malformation. And what we see is catastrophic. It's a danger signal like no others.
There is significant variance in the toxicity from lot to lot, such as the lot that I received with my second dose that almost killed me as I developed hypertension with systolic to 230. That there's some reason why some lots are associated with many more deaths and much more disease than others.
My life before my vaccine was beautiful. Sorry, it's hard to remember the worst parts of my life. I participated in a clinical trial for AstraZeneca, and now I suffer from a severe, debilitating form of neuropathy that will progress until I am essentially left in a care home.
I received my one and only Moderna injection December 30th of 2022. Within 1 week after my Moderna shot, I began to have numbness and weakness in my legs. I quickly received the diagnosis of transverse myelitis. This involves an injury to my thoracic spinal cord. I am now permanently disabled. If you have an adverse event after your shot, you are on your own.
There are currently enrolling 50 different clinical trials on other new mRNA vaccines. This product, which we've all agreed are inadequate, are now being grandfathered and essentially enabling a functional monopoly for Pfizer, Moderna, and BioNTech to deploy this technology for virtually any purpose.
There are plenty of drugs that have been shown to have antiviral properties, and they were very quickly identified around the world and widely used, not in this country.
About 40% of drugs used in hospitals are used off-label. That's fine if you're treating heart disease, but suddenly if it's coronavirus, the FDA, the CDC, the NIH do not want you to use an off-label drug because it would compete with big pharma.
I want to ask why the American Board of Obstetrics and Gynecology, why the American College of OBGYN, and why the Society of Maternal Fetal Medicine, all of whom I've served in a professional capacity in an outstanding fashion my entire career, why they are pushing this lethal vaccine, risking the future of all humanity.
Other nations have banned this product because it's too dangerous for younger people. What are we doing?
I am passionate for the health of our children. I'm also passionate for young service members that I served for 13 years in the Air Force as a flight surgeon, deployed twice to Iraq. For our healthy children and the majority of our war fighters, the data show that the risk for myocarditis is greater than the benefit of the vaccine products. As a physician who is vowed to do no harm, my opinion is that we should not mandate harm.
I can't believe that the FDA, where I've worked as a career medical officer, I'm the only person who's, out of the 20,000 employees or so at the FDA, of physicians, pharmacists, nurses, public health officials, that's here speaking out about this. I don't understand.
It's an outrage, a moral, ethical, medical outrage.
All the vaccine mandates should be dropped immediately. We need requests for applications and immediate funding for vaccine injury centers of excellence across the United States for screening, detection, diagnosis, prognosis, and management. We need a massive shift in our healthcare system towards managing now this large number of vaccine injured people.
It is absolutely irresponsible to continue any of these shots in our reproductive age kids or younger. Anybody that could possibly pass these on without investigating this, and I am demanding now that this be investigated.